In my view, we're going to be talking about an issue that has not gotten the attention that it deserves from the medical community, from the media, and certainly from members of Congress, and that is the crisis of long COVID. And long COVID, as we all know, is the fact that after people get COVID, sometimes there are symptoms which simply do not disappear. And we're going to hear from our panelists in a moment about that. So what I would like to say to our panelists, and by the way, we have a full house here, we have an overflow room over there, and I suspect a lot of folks are watching this on TV and on live stream. And I think there is the sense that something is going on in America which is serious that we're not addressing. So I just want to say to our panelists and all those who are dealing with long COVID, we hear what you're experiencing. We take it seriously. We think we have not, as a Congress, done anywhere near enough, and we hope to turn that around. The reality, as we're going to hear from our panelists in a moment, is that long COVID is a very serious illness that can have devastating consequences for those who contract it. In America today, and the estimate is that some 16 million people throughout our country have long COVID. It affects people of all ages and all backgrounds, although we're going to hear a little bit of evidence that it disproportionately impacts people of color and lower income people. For far too many people who were previously healthy, and we're going to hear from a former athlete this morning, who are leading active and productive lives, they have suddenly found themselves bedridden and grappling with strange, debilitating systems that they could not conceive of having gotten as a result of long COVID. And the truth of the matter is, and we'll hear from our experts after we hear from the patients, that we still don't know why. We don't know the cause of the disease, but this is what we do know. We know that long COVID can include more than 200 symptoms, including serious cognitive impairment and severe cardiovascular and neurological problems that can continue for weeks, months, or even years after initial infection. We know that people with long COVID have experienced a wide variety of chronic symptoms, including extreme fatigue, insomnia, migraines, brain fog, dizziness, shortness of breath, loss of smell or taste, and sometimes those diseases can be so debilitating that it leads literally to suicide. It's the case in my own state where a young man, previously healthy, committed suicide as a result of all this. So let us be clear. The symptoms of long COVID are not minor inconveniences. They are debilitating conditions that affect the ability of people to work, to care for their families, and to live full lives. And here is what far too many do not know. Long COVID, and we're going to hear more about this morning, can affect anybody who has had COVID-19, from those who experienced mild symptoms to those who were severely ill. Further, although you may not have long COVID after your first infection, each reinfection can increase the risk of developing it. In other words, if you're under the impression that once you've gotten COVID, you don't need to worry about it ever again, you are mistaken. This is an escalating danger, particularly for those who have suffered repeated infections. It poses a severe threat to public health, and it demands our immediate and focused attention. And let's be clear, the impact of long COVID is not just a health issue, it is an economic one as well. It is estimated that as many as 4 million Americans are out of work due to long COVID. The annual cost of those lost wages alone is around $170 billion a year. So what should we do about it? First, we must educate medical professionals on how to adequately diagnose long COVID, better understand the risks associated with it, and identify potential therapeutic options. Far too many patients, and I think we're going to hear a lot about this morning, with long COVID have struggled to get their symptoms taken seriously. And far too many medical professionals have either dismissed or misdiagnosed their serious health problems. This crisis is made even worse by the fact that long COVID patients often require multiple specialists to treat their complex symptoms. The existing shortage of healthcare providers, from primary care to mental health providers, means that far too many Americans are unable to access affordable, high-quality care when they need it. That's another issue that some of us hope we can address in the near future. So let me just conclude by thanking our panelists, both the patients and the experts who we will be hearing from in a moment. And let me give the mic over to Senator Cassidy.
Thank you, Chair Sanders. I'm a doctor, and I worked for a long time with people who had chronic fatigue syndrome.